Now scanning the gallbladder. The gallbladder is full and distended. Here we see the sludge in the gallbladder. And this is calculus. Now we will measure the size of calculus. The calculus size is 7.9 millimeter. This is junctional fold, which is normally present in the neck of gallbladder. Here we see the gallbladder wall is thickened and echogenic. But here we see a calculus which is present in the neck of gallbladder. Here we see the shadow of stone. This stone is difficult to scan. Now we will measure the size of stone. The size of stone is 7.6 millimeter. Now here at the neck of gallbladder, we see that the wall of gallbladder is thickened and echogenic. No pericholecystic fluid present. Now we will measure the size of gallbladder wall. The gallbladder wall thickness is 5 millimeter. The normal gallbladder wall thickness is up to 3 millimeter. Now we will measure the length and width of gallbladder. The length of gallbladder is 97 millimeter and weight is 45 millimeter, which is normal. The normal length and width of gallbladder is up to 100 into 60 millimeter. Now how we will write report.